Good afternoon, everyone, and thank you for attending today's WHRTN webinar on the story behind Spark, how we co-created a social connection initiative for women. My name is Dr. Nadia Corsini. I'm a Senior Research Fellow from the Rosemary Bryant AO Research Centre at the University of South Australia. I'd like to start by acknowledging the lands that we meet on today and pay my respects to elders past, present and emerging. Today's presentation is about an initiative we created called Spark. It came about through the WHRTN co-production grant. That was a 2-year project. It has recently come to an end, and today's presentation will be presented by two of the key personnel behind this initiative, Dr. Jodie Scott from University of South Australia and Hayley Everest, who at the time was the community lead at the Hutt Community Centre. This project was a partnership between UniSA and the Hutt Community Centre, and there are a number of other partners involved as well in helping drive the kind of ideas behind how we would undertake this particular project. So Dr. Jodie Scott will kick off the presentation today. Jodie is an ECR and we'll be talking about the co-design process that we undertook to develop Spark. And she'll also share her learnings as an ECR, so how this project evolved from her perspective, the impact it had on her career and what she learned. So hopefully that will be of interest to ECRs and MCRs who are with us here today. Hayley Everest will be talking about the partnership between the community centre and the university, and from her perspective, how that evolved, how we worked together, and what her and how she and the Hutt Community Centre worked with the university to develop the initiatives underpinning Spark. I will now hand over to, before I do that, if you have questions today, which I hope you do, and I encourage you to ask questions, if you could please add them to the Q&A section of the Zoom. So instead of using the chat, please use the Q&A, which you'll just see a little bit further on next to the share button, and I will take a note of those, and at the end of the presentation I will open it up to discussion. I also wanted to remind everyone that the recording for this session will be available about a week following this presentation on the WHRTN website, if you did want to go back and review anything that was presented today. So without further ado, I will hand over to Dr. Jodie Scott.
Thanks, Nadia, and welcome everyone. So Spark is a community academic collaboration co-designing initiatives to address loneliness and ignite human connection. It was funded by a WHRTN co-production grant and led by Dr. Nadia Corsini. So the project is a collaboration between the Rosemary Bryant AO Research Centre CoLab and the Hutt Community Centre in Aldgate. And these are the partners from the original project, which was called the Loneliness Project, which is where Spark originally started. So our partners and other collaborators have really been integral in bringing the project to life. Loneliness is more than just a feeling. It's a growing public health crisis with critical physical and mental health impacts. And it's really, really common. 1 in 3 Australians are lonely. Loneliness arises when your current social relationships don't meet your social needs. It's really a longing to belong, and it's a subjective experience, which means it's different for everyone. And the World Health Organization describe overall well-being as a balance of physical, mental, and social health. And while we often work to improve our physical or mental health, our social health is often neglected. The impact of loneliness on reducing lifespan is equal to that of smoking, obesity, and physical inactivity. Our team have used a scientific process to address a real-world challenge. The work centres around co-creation principles with a co-design, implement, evaluate, and scale approach. The initial seed funding saw the team co-create a topic around women's health, with loneliness emerging as a key priority among midlife women who have very high levels of loneliness due to life transitions at that life stage. Our research project was initially called the Loneliness Project. Our pilot site was the Hut Community Centre in Aldgate in the Adelaide Hills, who have a motivated team of community development professionals who were really keen to tackle this problem of loneliness that they were seeing within their community. As researchers, our commitment was to ensure the co-design process and the innovations created were evidence-based and effective in addressing loneliness at the community level. Evaluation takes place across the entire project lifecycle using a measurement, evaluation, and learning approach so that adaptations can be made to improve what we offer. Our team had a really clear vision of what we wanted to achieve from the outset, to create initiatives to address loneliness that can be rolled out through community centres. So the aim was to create environments that encourage social connection and increase the capacity of community centres, especially to attract people in midlife that were more difficult to attract to community centres. As loneliness researchers, our team were really inspired to address the problem from the community perspective as opposed to an individual approach. And the aim was to strengthen the community from within. So the co-design process aims to build empathy, to generate lots of ideas, to build and test prototypes with the people that you're designing for, and then create new solutions that hopefully can help improve lives. So it's also about valuing professional and lived experience equally. We also know that community level interventions are more effective when the community are engaged in their development. And the co-design process can actually be considered an intervention in itself in bringing people together for a shared purpose. Loneliness is a really complex issue to address, and there's no one experience of loneliness, hence there is no one solution. And this really underpins the importance of the co-design process within community. Our major co-production activity was a series of co-design workshops conducted over 3 sessions across 3 weeks in the garden at Stangate House. So 22 women joined the workshops, 86 women shared experiences and ideas in an online survey, and 10 interviews were conducted after the workshops to gain further insights on the proposed initiatives. And while some women were currently lonely or had been lonely in the past, others just really wanted to be part of a solution to a challenge that they were seeing in their community. So all experiences were welcome. This is often not a linear process. We used a design thinking approach, which is an iterative process for creative problem solving that focuses on really understanding the problem and the community to help innovate solutions. And co-design is unique in that the outcome cannot be predicted. So we had to learn to trust the process and the skills and the know-how within the community and within our team. In session 1, women were asked to think about their current connections, so based on the social ecological model. They were also invited to share specific experiences to paint a richer picture of key moments that have influenced their own social connections. Then they were asked to step into the shoes of someone experiencing loneliness. What might they feel, think, or say? Then they brainstormed. So we used divergent and convergent thinking, so going wide to find insights and then narrowing the focus to refine ideas. We wanted the women to really think about what initiatives they might be interested in, what is lacking perhaps that could be changed, in what ways would they like others to involve them. And they were encouraged to brainstorm on their own and then build on the ideas of others. Session 2 involved developing the favoured ideas or themes within their groups. So this is when we set some parameters. The women were asked to consider things like how it met a need in the community, whether it would have broad interest, does it build capacity and strengthen what already exists? Also to consider what the wow factor might be that might create excitement and make people want to get involved. And we ended up with notes and ideas and diagrams of how they see an initiative working and factors that might ensure its success or help develop sort of the personality of the initiative. In session 3, we asked the women to further refine their ideas. And why is really at the centre of the project. It's our purpose or our motivation, and it's what excites us about the project. We asked the women to think about their ideas under these terms. Each group then pitched their idea and we opened it up to feedback. I'll pass over to Hayley now.
Thanks, Jodie, and really lovely to be here with you, everyone. So I thought I'd explain about why the name was changed from the Loneliness Project to Spark. So this was really important when we transitioned between the co-design process and into creating the actual initiatives that were promoted out into the community. And what we heard at that point from the women who were involved in the co-design was that the comfortability of the word loneliness it wasn't a comfortable term for people in terms of wanting to come into community initiatives. The purpose of our project is to reduce the stigma of loneliness and speak really openly about loneliness. So this was a little bit of a dilemma for our team to hear what the community was saying. And although we wanted to focus on the word loneliness and really use that in a comfortable way, that we had to listen to the community, that a more approachable name was necessary to engage with people. So that's the background, I guess, of why the name transitioned. Thanks, Jodie. Yeah, the next slide. Thank you. So the role of the community centre was to engage with the community members. And we did this initially through recruiting. We needed people to join into the co-design. So you can see that communication there in the top corner. That was similar to what we were putting out into the community through newsletters, community newsletters and notice boards and social media to ask people who in the community would like to join our team to address loneliness. And as Jodie said, we had a range of ways people could do that through online surveys and interviews and coming to the co-design workshops. I thought I'd share with you a couple of the challenges and benefits from the community centre's perspective of working with a research team. It was very new to the HUT Community Centre. I think the community worker, development workers, generally it's quite a rare thing to work directly with a research team. And so I guess a couple of the challenges that we came across was the language being used in some of the communications, the evidence-based language. We really needed to change that into more approachable language for the community. So that was something that we worked on together. I think we did that really well. And also, I think the complexity of working with a university team, for example, the ethics approval needed, that's not something that in the community we normally need to navigate. So, some of the timelines that were perhaps longer than what a community centres are typically pretty nimble and work pretty quick. So that was something that we had to adjust to as a team, was to take the lead from the researchers in creating something that I guess had that extra depth that in the community we're not used to operating quite like that. In terms of the benefits, I mean, there are so many. Certainly, as Jodie's mentioned, the blending of the perspectives and experiences. So the expertise of the way that we work on the ground with community blended with the evidence base and the depth from the research team was something really unique, and I think just such a strength of the project. And also for us, the additional resources that came with the time, not just the time that, Jodie and Nadia and the team were giving to the project, but things like, developing the evaluations. We do evaluation in community centres, but certainly not to the depth and with the tools that the research team were bringing to the project. So that it was just an absolutely unique and wonderful thing for us to be able to be involved in, and not in past tense, it's still going. Thanks, Jodie. Yeah, next slide, Char. So out of the co-design workshops, as I said, we created Spark, and we created a range of initiatives, new initiatives. So these were the ideas that came from the co-design. So a conversation group where people gather to have meaningful conversations in cafes. We had an 8-week personal development program that was developed by a couple of the people from the co-design workshops who had the skill set in occupational therapy and psychotherapy to create quite an intensive program. And then social sessions as well, so walks in nature and also creative workshops. And those came from the perspective of what sparks joy for you. This is something that came out of Spark as well, is really focusing for people what sparks joy in terms of helping to bring connection to self and to connect with others, doing things that you might have in common with other people, and that creates a depth of connection. So what we realised, though, is that the initiatives on their own were not particularly unique or innovative, because most community centres will have a chat group, they'll have a walking group, they'll run programs, development programs at various times. But what became apparent pretty quickly about Spark was the suite together. So the various innovations put under an umbrella, or what we call the Sparkyverse. so that people can come into Spark and come into the initiatives and actually join more than one. Also, the point of difference and the innovation, what we believe we haven't quite seen in other settings, is that Spark initiatives are about the connection first. So often community centres, as I said, will have these programs, but you're coming for the purpose of the activity. In our communications with Spark, we really focus on drawing in a range of people. So we use language like, are you new to an area? Do you love connecting? Are you lonely or isolated? So we use a mix of those to draw a range of people together for the purpose of connection, and the activity is secondary to that. So we're finding that that's quite unique, plus that mix of communication that brings a cross-section of the community together who value connection, because what we know evidently is that bringing chronically lonely people together on their own is not how we create solutions to loneliness. It's actually bringing people who are also good at connecting or that have really excellent social health to model, demonstrate and raise courage for people who are experiencing loneliness. That is what we see in the evidence to be effective. Also, you'll notice, and Jody, you can just switch to the next slide, I think. You'll notice the lightheartedness of Spark, the joyfulness, it's bright. Again, we heard this all out of the co-design, that's what people want to experience. It's juxtaposed to what we might normally see, when we visualise loneliness. People want to be engaged and they want to be involved. This is what we heard through the co-design, that they wanted to be involved in activities that don't look like a service or a traditional service model. And again, this was all possible because we were able to take the time to hear from the community and develop these and test these and listen. So that, again, that research element was just absolutely vital. And what we also heard through the co-design was that, as well as the initiatives that were designed, and you can see there's several of them, which was more, as Jody said, we had no idea what was going to come out of it. We just went with it, trusted the process and developed quite a number of new things. But also we heard that if we were having initiatives out in the community where people were coming together, that we needed people who could host these initiatives and create welcoming environments. So as well as the initiatives, and next slide, Jodie, would be great, was a role of a volunteer. So a volunteer who can be at these initiatives to gently facilitate. And so the Sparkies were born. And what we've done is also created a training session. So the Sparkies are registered volunteers of the community centre. And so that's a way of increasing the community capacity of the community centre, bringing new volunteers into the community centre. And then we train them in a range of things. So we go through the evidence base of loneliness with them, so they have a greater understanding of the topic. We teach them how to create inclusive spaces and how to actually create that sense of belonging in a social space. It's not an easy thing to do at times. And also then we're teaching them how to collect the data that feeds back into the evaluation. So they also have become our storytellers, the Sparkies. So some of them, as Jodie said, some of the people that have participated in the co-design and also come through to become Sparkies, they have lived experience of loneliness, sometimes currently, sometimes in the past, and wanting to share that, and a range of different skills. We have nurses and counsellors and quite a cross section of experiences who are the volunteers. And they are able and willing to share their stories as a way of helping us to reduce loneliness. That's become a really powerful tool for us. So Sparkies are the citizen scientists as well. They collect the data for us in an app that's been developed by the research team. And again, this was co-designed so that to make it really accessible for the Sparkies to use and collect this data. So you'll see there a range of data that we've collected across. Yeah, I should go back. Thanks, Jodie. Around the number of initiatives, how many sessions, the attendances, how many volunteer hours, and then a range of comments that the Sparkies will observe and collect for us. And this has been just such a fantastic minute by minute update. Almost as the initiatives happen, we can go in the back end and we can look at the feedback. So we ask for feedback as well and challenges so that we can address that with them as they're as we're experiencing Spark in real time. And again, that's just not something that a community centre or community organisation would really have access to. So I think back over to you, Jodie.
Thanks, Hayley. So there are some really big challenges in evaluating community programs where the events are sort of low pressure environments like hikes or cafes, rather than a research project that your participants are signing up to. We used a place-based evaluation approach using the MEL framework, so measurement, evaluation and learning. And the learning part is really important so we can adapt to improve the program. And along with that, social connection is also really difficult to measure. Our team's innovation to solve this challenge was to create a unique model really for evaluation, which is sustained by our Sparkies, as Hayley said, who act as citizen scientists across the project. They upload data to the platform after each session, noting how many attendees, how many were repeat visitors, and how the event unfolded. So what was the feeling in the room or at the session? Our evaluation includes a mix of numbers and stories. We also interview Sparkies and attendees to gather insights that can help inform future Spark and to show the social impact. We also check in every so often with the Sparkies to inform any improvements or to problem solve emerging issues that come up. And from little things, big things grow. So Spark has had ripple effects, not just in the community, but also for our team. Since the original version grant, we have, since the pilot project, we have secured nearly $1 million in national funding to expand Spark across 2 new local government areas, with 14 community partners and several academic collaborators as well. These new communities will identify a group where they see the social connection needs are the greatest, and will again undertake a co-design process within these communities to ensure new initiatives are tailored to their needs, their interests, and the context of that community. We've been able to refine and develop our co-design and evaluation techniques and evolve our learnings on what helps to increase social capital. So this information feeds back into the research cycle to create new evidence, to adapt and improve both the process and the outcomes. Spark has twice been tabled in the SA Parliament Hansard as an example of research translating into meaningful change, social change. It has also enabled several ECRs like myself to have a really unique research experiences across community engagement, the co-design process, and evaluation. We have also supervised an honours student, several physio students, and a research assistant in working on various parts of the project. And through smaller grants associated with the project, we have also been trained in the MEL place-based evaluation techniques and also podcast producing. A team have also published an article with several more being prepared or under review. So Spark has piloted a sustainable and effective model to increase capacity and the reach of community centres, addressing a pressing health issue in loneliness and being able to strengthen those community and academic ties. It's also increased awareness about social health and its impacts on physical and mental health. So our key learnings, just listed a few of them here, but the co-design process was effective in creating tailored innovative solutions to address loneliness within the Adelaide Hills community. And the community were really motivated to address a health issue that they were seeing in their community. And the experience of this has really provided a sense of purpose for many who were involved. And many were keen to stay attached to the project and become one of our passionate Sparkies, which is wonderful. The flexibility of Spark allows people to choose how and when they want to connect with others. So just as there's no one experience of loneliness, there is no one solution that will suit everyone. And the language used and how the issue is framed also needs to be adapted to context, as Hayley mentioned as well. So on that, one thing we needed to do was when we created the men's project was to turn that messaging around. So while loneliness resonated with a lot of the women and we had a lot of interest in finding solutions from women in the community, the concept really didn't resonate as well with men. Our team is all women, so we collaborated with men's circle facilitators who helped advise us on adapting the messaging to better reach men. We found that there was a better response to the terms connection and mateship, which really speaks to the need to tailor both the methods and the process to the context of the community that you aim to reach. The second learning is about trusting the process. So as a researcher, Spark is a fairly unique project. So some areas of science are rigid and formulaic, but co-design is challenging because you really don't know what will come out of it. And it can often lead to some really surprising outcomes. And the iterative process of community co-design workshops and follow-up sessions ensured that the solutions were feasible and that decision-making was collaborative at every stage. It also ensures that there's a shared vision for the project that is upheld and that those involved feel sort of a sense of ownership over Spark. They feel invested in the outcomes. And I think that's one thing that has helped it succeed. So it's really a side-by-side approach with the community centre, the academic team and the community itself. And the third learning is sort of shaping your ECR experience within a project. So focus on finding your niche within a project. So the co-design area really resonated with me. There's a lot of opportunity for innovation in this area. Things like we did co-design workshops in a garden in the Adelaide Hills to enhance that creativity and to build connections among the participants, which is not very common in a research context. Likewise, the design thinking techniques sort of prompted people to think differently about a challenge. We also engaged our volunteer Sparkies to be citizen scientists and gather data, as we've mentioned, at each event, which is also an uncommon method of data collection. And social connection is really challenging to address and challenging to measure. So trying to seek out new methods or challenge the accepted way of doing things within a research context. There might be other solutions that haven't been thought about yet or haven't been tried. And for me personally, I really appreciated having experienced researchers within the team who were really great mentors to learn from. I also like the multidisciplinary aspect of the project. We had specialists across areas like mental health, co-design, research translation, community engagement, and also policy. And it was wonderful to learn from their experience as an ECR. Thanks very much for listening, everybody.
Thank you very much, Jodie and Hayley. I love listening to you speak about the project, and hearing your insights is really great. For the benefit of the audience today, I wanted to let you know that Spark is continuing. We are moving into 2 new regions of South Australia, 2 new council areas with some funding from an NHMRC partnership grant. So projects like this, co-design and pilot work that is novel, can lead to opportunities to undertake further research, and we were so thrilled that this pilot work that we have contributed to has led to some further funding to support our team to continue the work. Now I will open up to discussion. I have a question in the chat, and I think there are some, in the Q&A. Please add further questions in the Q&A, and I'll just double check the chat as well. Okay. So there are 2 questions that refer to populations. So were there cold populations involved? So Jodie or Hayley, who would like to take this question?
Cold populations weren't specifically targeted, although there were some members of cold populations as part of the workshops and coming to Spark events now. It is something that we have thought about for the future, targeting some minority groups that where there's obvious needs. I know at a conference it was, I did have some questions about targeting migrants, especially who have high rates of loneliness. Also within university context, there are international students who have really high rates of loneliness. So it is something we will think about for the future.
I'm also just happy to add that the Adelaide Hills isn't a particularly culturally diverse community, so we do always struggle as a community centre to achieve that diversity, unfortunately. But yeah, exactly what Jodie said. Certainly keen to target in future. Yeah.
With the 2 new regions, we'll work with the organisations that we're partnering with to determine the populations that will be the focus for next Spark. So we haven't decided that yet. In this first iteration, the focus was on midlife, so we weren't particularly excluding a group as such, but the focus was on age, on that life stage. In the new regions, it is open to be determined, so we will provide updates on that as we go, and it may well be that we focus on a particular population. Another question related to population, which we may have covered, but just Hayley and Jodie, if you have any comments on trans, gender diverse and sexually diverse communities.
It's not something we've thought about yet with the pilot project, but it definitely could be in future Spark to target those communities.
Thanks, Jodie. Question from Jenny. Co-design often requires people to share, even relinquish power, and this can be hard for senior academics who are used to holding power. How did the project encounter and address this? So maybe a comment from both of you. Might start with you, Jodie.
Yeah, we did try to address that power imbalance early on in the co-design workshops by stating that it's a side-by-side rather than a top-down or a bottom-up approach. It really is a side-by-side process in co-design to try and address that power imbalance and really let that lived experience voice be heard through the process.
Hayley, how do you think we did?
I was going to say, you guys are so lovely. I didn't notice any kind of power struggle there. But as Jodie said, we did address that early on. And it was part of the introduction of our co-design sessions. And I think we've carried that through Spark in the culture of acknowledging the lived experience and the life experience and the mix of academic and community and professional experiences within the team and within the Sparky group as well. I have learned so much from some of the Sparkies and their lived experience around inclusivity and what that means for people and how do we create that. And I think we're all quite vocal about valuing that. Yeah.
Thanks, Hayley. Another question here. Has Spark considered to expand the program for the younger population as they also experience loneliness? Yes, indeed, they do, often in higher levels than other age groups. However, they do not speak out like the older cohort.
Yeah, I mean, similar to the other groups that we've discussed is that we'd love to work with youth and target youth as well and create initiatives specifically for that target age group. And again, we have to be mindful of how we do that and who we partner with to make sure our language is correct and that we do attract. I mean, that's certainly part of the challenge, and it was the challenge with the women and the men as well, is how do we frame things in a way that makes people want to participate. So we're definitely up for that challenge, and we're certainly hearing that from potential community partners too, that's who community centres want to target also. So I think it's only a matter of time.
I think that covers all the questions that have been posted. Are there any others? Feel free to drop them in. Oh, here we go. I'm scrolling down here. Okay. Well, this is an interesting question. How did you initiate the community centre engagement? Would you like me to take this one?
Yes.
So this happened actually before Jodie and Hayley's involvement in the project. So initially, WHRTN provided a seed grant to research translation centres around Australia, and the Health Translation South Australia was one of the recipients of the initial seed grant. And we brought together a team to co-design a project within the area of healthy ageing or women's healthy aging for women was the South Australian project topic. Over a 6-month period, we undertook engagement. We did stakeholder consultation with various organisations and women from different walks of life to understand what topics resonated in the area of healthy aging. So what should we be focusing on as researchers? What research can we translate to address what issue for women to help with aging well? And through this 6-month process, the topic of loneliness emerged, which we were surprised about. It's not something that we anticipated would be a priority. Now, as part of this stakeholder process, we engaged with a number of organisations to understand who else was interested in addressing loneliness. We looked at the literature. We did a fairly wide scoping activity. Through this process, we formed a connection with the Heart Community Centre, who we had a connection with through one of our research team members. So there was an existing relationship through one of the researchers on our team. And through discussions, we came to an agreement that the Heart Community Centre would be interested in collaborating and being a pilot site to develop initiatives for women. Now, the reason the Heart Community Centre were interested is because community centres, if you don't know, the mission of community centres is very much about connection and building community connections. So there was a great values alignment. And the research told us that loneliness in midlife women was a particular challenge. So it's a transition period that where we see an increase in loneliness. And the community centre was interested in that age group. It's not an age group that they're typically able to engage for many reasons, some historical, some timing and when people are available versus when the community centre is opened. So it was a challenge that the community centre felt was of interest to them, and there was a good values alignment in terms of what we were trying to achieve. And there was an existing connection. So there was some initial, I suppose, trust and familiarity between the two parties, although not with everyone in the team. So that was how the partnership came to be. I'll just check. I think there's one more question here. What data, this is about the citizen scientist approach. What data did you get from the citizen scientist approach that you wouldn't have got otherwise? Can you comment on return on investment for using this method?
So the citizen scientist approach was used because the visitors who come to events, and there are at least 4 events every week, plus, weekend hikes and things, that data wouldn't be captured unless the Sparkies captured that data. So it's people don't sign up to as a research participant, they just come along to a cafe. So unless that data is captured by someone who is hosting the event, it just doesn't get captured by the researchers. So this was a way of capturing that data really without signing people up to a formal research project. So for their, they just turn up to a cafe or a hike, and the data is captured by the Sparkies who host the event, rather than them having to go through a formal research participant process. So the idea really was to make it a low pressure environment where they just have to turn up. They don't have to book ahead. They don't have to, make plans beforehand, register or anything. They just turn up to a cafe. So unless our hosts, Sparkies, were capturing that data, it just wouldn't get captured by the researchers. As far as return on investment, we do plan to do a social return on investment across the new regions. So we will hopefully capture that data. I don't know if you have anything to add to that, Nadia.
It's an interesting question and something we did grapple with. So we learned in the co-design process about some of the barriers to participating and attending events, and they included having to sign up, having to plan ahead. So we knew early on that we couldn't have we couldn't have a model that required people to do that. We would never have a captive audience. It's a transitional, it's a transitional audience. People are coming and going through the programs. Requiring people to then complete a survey or to divulge information about themselves, particularly whether they're feeling lonely, which of course we would love to be able to capture, is something we felt, and also the participants, the community felt that would be counterproductive. So we wouldn't achieve our objectives if we were asking people to register or asking people to tell us about themselves. This is something that we will continue to revisit as we learn more about what works and what the barriers are, and whether our assumptions on that line are always correct. But we made that call, and for this particular set of circumstances, I think it was the right call to make. The other consideration is that you might remember sort of Jodie at the start talked about the level that our intervention was focusing at, and it was the community level rather than the individual level. So our focus was on building capacity for the community, building capacity for the community centre. So while, of course, our ultimate aim and our long-term aim is to address loneliness, that isn't something that is ultimately within our control. What is within our control and what we're trying to change is the reach of the community centre, the skills and capabilities of the staff and volunteers within that community centre to be excellent connectors in their community. And over time, we will learn about what the ripple effects are from those capacity building actions for individual outcomes. But it is sort of a downstream impact, hence why we are not measuring individual level outcomes, at least at this stage. Let me just quickly scan for anything else. Our publication, people have asked about the publication. At the moment, so we have a publication that describes the co-production methodology from the beginning. So what I was describing earlier about how the community engagement came about, that's in Frontiers Public Health, called. We'll send the details out to you, but you should be able to find that fairly easily with a search in Frontiers Public Health. I think we have a comment here. Salute your problem detection skills. What measures are in place to ensure the long-term sustainability of the intervention, particularly within the beneficiary population communities? Hayley, did you want to speak about sustainability?
So the design of the initiatives and with the Sparkies, essentially having them in place creates a community-led effect. And that's really what we're trying to influence. So although early on, as we're navigating what works and what doesn't work, we've been quite hands-on. As we continue and into the next phase of the project, we'll really be focusing more on how to genuinely create that community-led action. So bring the Sparkies in earlier now that we have that program in place, and that the initiatives then become essentially embedded in the community centre. So for the Hut Community Centre, those initiatives, they're now day-to-day business of the Hut, led by the volunteers. So the idea is that there's not a lot of work required by the community centre to keep those going, as long as the volunteers remain engaged. And Spark's role in that is to provide that, I guess, overarching volunteer coordination and ongoing training as we identify challenges that are coming up or new skills that we might need to create. But certainly, you know, that is absolutely what we'll be focusing more on next, is what do we need to have in place to ensure that those initiatives remain sustainable. So having the you know, the community centres as satellites of Spark, and what structures do we need to put into place so that we're using minimal resources to keep all of those initiatives going long term. Obviously, there is some structure needed. So in terms of, you know, creating a sustainable funding model for Spark as well, that's certainly something we'll be focusing on in the next couple of years. And how do we create, I guess, a mix of income, funding income. Did you want to add anything more to that part, Nadia?
It's one of our research questions for the next project is around sustainability. And so we will be looking at understanding to what extent we've embedded the new initiatives and processes within the community centres by continuing to observe progress in the Adelaide Hills, as well as specifically look at the 2 new regions to understand, you know, whether the model is applicable to the new regions, or whether there are different strategies required to embed Spark in practice. So that will be a focus of the next 2-year research project.
Something just to note, what we've already learned is that the initiatives that have been created that are weekly in the same location at the same time, and therefore the promotion is very streamlined, they're less onerous to coordinate than an initiative that changes each time. So just from an operational perspective, that's something that we've already learned. So when we go to create new initiatives with the new regions, that will be our recommendation, is to create initiatives like that. Then we know they're more likely to sustain and need less resources.
I think we also found that we created more initiatives than what was probably humanly feasible for the team. And so next time we'll be looking to focus on, you know, 1, maybe 2 new initiatives, but ideally 1. It's really quite challenging to develop several initiatives, even under the 1 umbrella. So that's something that the team have learned to scale back on the ambition a little bit. And that's something that will also be a new challenge in the next phase of co-design, is how do we navigate the consensus making process that will see a number of ideas formed during the co-design. How do we decide which 1 or 2 of those proceeds to the kind of concept, past the concept development phase to the development of a working initiative? So we look forward to sharing how that goes. I really want to thank Jodie and Hayley for your time today and for sharing your insights. I hope that the audience here today have learned a lot, that it was useful to you. Feel free to reach out to us if you have any questions about Spark. We do have a website, sparkconnection.org.au, if you would like to have a look. And please, if you could stay on, or please continue to complete the evaluation that will be prompted at the end of this session is very, very quick, and it provides WHRTN with information to improve the webinars to ensure that they are meeting your needs. So that would be excellent if you could please spend 1 or 2 minutes to answer a few questions for WHRTN. Thanks very much for today, and I hope you enjoyed it. Thank you again.
Thanks, everyone.